Hello, everyone. Screen a little better. There we go. Hello, everyone. Good afternoon. Nice to be here in the office today. A little bit unusual nowadays with this coronavirus going on, but nice to be here today. So, just everyone, as you sign in, let me know how you're doing. Today, I wanted to talk about Remdesivir, antiviral medication that has shown some promise to help severe COVID illness. Certainly, people who need to be hospitalized. It's in Remdesivir is an antiviral drug. It stops the replication of the COVID-19 virus. It had been tested against Ebola initially, but was not effective there. But with this global pandemic, they decided to try it, and preliminary studies show that it is indeed promising. It shows that people recover quicker, shows that people recover in 11 days versus 15 days for people who did not receive remdesivir. And the mortality rate was 8% on people who received the remdesivir and 11.6% on the people who did not. So, a significant decrease. Does have some side effects, can cause low blood pressure, nausea, vomiting, sweating, shivering. Of course, those could also be side effects from the actual COVID-19. Can also raise liver enzymes. So, it's not a drug to be taken lightly, and it's only given intravenously. Should have said that in the beginning. Drug is only given intravenously. So, but at least this is one of the first therapies that's shown real promise. I know that there was some initial enthusiasm for hydroxychloroquine or hydroxychloroquine plus azithromycin. Some other studies have not shown any efficacy, and shows people who are getting hydroxychloroquine, some of them were having cardiac complications, arrhythmias, which for some people unfortunately included death. So wasn't felt that there was appears, at least in the US, to have fallen out of favor, even though people have, I believe, are stockpiling it. And the folks who really need it, the folks with rheumatoid arthritis and lupus, for which it is efficacious, they're having trouble getting hydroxychloroquine right now. So I would not recommend stockpiling it, the hydroxychloroquine. A lot of people who don't need to go to the hospital just get better without that. There are some other drugs that people are trying. There's an experimental antiviral, so new that it doesn't even have a name yet. Say A1DD-2801. Its effect on the coronavirus is damages the DNA, and the coronavirus can't function effectively then. Whereas the remdesivir actually totally stops the viral replication. So slightly different mechanisms of action. Remdesivir has been around longer, so we have a little better idea what's going on with that. So as I said, remdesivir looks like there's some at least promising data, and it has been granted emergency use authorization to be used against coronavirus. So it's possible that if you go to the hospital, I'm hoping that doesn't happen to anybody that is listening to this, that people are taking steps to improve their resiliency and resistance to coronavirus. But if you do if there's somebody that has to go to the hospital, at least there's at least one promising drug. They're also doing studies on immune suppressants. Thinking is that if cytokine storm is the mechanism for many people dying, that by suppressing the immune system at a certain point, you can actually help people survive better. Again, this has to be done at the right time. You don't want to suppress the immune system too early, because for many people, they'll be able to fight off the coronavirus. But if gets to a point where people are having trouble and the body ramps up the inflammation to the point where it starts damaging organs, it would make sense that suppressing the immune system at that point could be helpful. I believe the main one that they're studying for that is Actemra, a drug used in rheumatoid arthritis. And the generic name for that is tocilizumab. Tocilizumab. And there's some, promising initial data. I don't think it's been studied in a large number of people yet. So, hello, Nancy. Did you get to hear the summary on the remdesivir, or did you get in just a little bit too late for that? The governor has decided to keep the schools closed in New Jersey for the rest of this school year. That is a lot of kids are going to be schooled at home, supported the school systems. This is Teacher Appreciation Week, by the way, so I think a lot of parents who have had to take over the homeschooling of their children, even with support from the school, are appreciating the teachers more. At least that's what some people have indicated to me. I'm going to review the remdesivir one more time. It is, a drug that was originally developed for Ebola, but wasn't very effective for Ebola. But due to its mechanism of action, it stops viral replication. They decided to study it against COVID-19. Shows that when it's used intravenously. When it's used intravenously, that it shortens the recovery time from 15 days down to 11 days. This is the same metric that they use for influenza patients, shortening recovery time to see if something's efficacious. And the mortality decreased from 11.6% in the folks who did not get remdesivir to 8%. In the numbers used in the study, even though this was promising, it didn't actually reach statistical significance. So, but certainly promising. Probably just need a study with a large number of people would usually help settle that question. And also, it was the company who makes it, Gilead, was studying 5-day versus 10-day regimens. figuring that with the limited supply of the drug, if 5-day was as effective as 10 days, we can get the drug to more people. And it does appear that 5 days appears to be just as efficacious. So that's the major news on remdesivir. First drug that's been shown to be promising, and it's received emergency use authorization. Of course, that happened with the hydroxychloroquine, and now people are not so thrilled with that. There's been some increased cardiac mortality with that. So let's see, Nancy S. heard that emergency brand supplement is being used for the hospital COVID patients. I don't know about that, Nancy, if that particular brand is being used. I do know from studies on using vitamin C, intravenous vitamin C for sepsis, that there were studies that showed that it was efficacious. I don't know that the emergency brand is the one that is being used at any or all of the hospitals, or even, again, any of the hospitals. I did hear that intravenous vitamin C is, has been helpful for sepsis, and we certainly feel it's helpful for patients with COVID-19. I'm not really sure which the which hospitals are using it or not. She also asked for what the term chelated means. Chelated means that you can combine a mineral or vitamin with amino acid to form a complex. So it's thought that this would help the effectiveness of whatever is being chelated, whether it's calcium or magnesium or so. Hope that helps you out, Nancy. Any folks have any other questions? All right. Certainly coronavirus, everything is developing, and many of the big controversies are when people should start opening up. Love to hear from people about that, what they feel about that. Certainly that's the one of the hot topics we have right now. So, all right. I will keep this brief for people today. And certainly feel free to contact me if you have anything else. Okay. Any questions about Remdesivir? Oh, what I did want to mention again is Immersive Masks project. Great local fundraiser, trying to keep our frontline healthcare workers healthy. Because of the dosage of coronavirus that the frontline healthcare workers are receiving, many of them get sick because of that. So helping them out by helping with the mask could be helpful overall for our community. And the other thing I wanted to point out is the supplements that can keep your immune system healthy and hopefully prevent you from getting coronavirus, even if you're exposed, or keep it as a mild case if you are exposed. I'm going to repost those when I jump off here. All right. And if you need help with any of the supplements, please contact us. Please check out Jenna's immune support group. Lots of good information there. And for folks with cardiovascular risk factors, our hip heart disease group. Okay, everyone, have a great Wednesday, and I will talk to you on Sunday at 9 a.m. Take care. Bye-bye.